Hello everyone and welcome to our today's webinar, Working as a Nursing Professional in Germany, with our experts today, Hatice Özyoğurt and Pavel Posselt from the ZAV. I don't know, do you actually say ZAV in English? How do you do it? Do you say ZAV? I think so. Perfect. So today, actually, my colleague Jean-Marc is supposed to be here with us. He's going to come later because he had network problems, but we will start already, not to lose time. So today, we will focus on a few topics. Let me share my, screen so that I can show you today's agenda. While I do so, maybe our two experts could say one sentence to our participants. Who are you and why are you talking to us today?
My name is Pavel Posselt. My colleague Hatice Özyoğurt and me are going to give you a broad overview on the following topics in combination with nursing professionals working in Germany.
Yes, hello from me too. My name is Hatice. As Pavel mentioned before, we work for the ZAV, Zentrale Auslands- und Fachvermittlung. We are part of the German Agency for Labor, and we are here today to give you a brief overview of working as a nursing professional in Germany and how we can support you with it if you plan on doing that.
Perfect, thank you. Can you see my screen now?
Yes.
Perfect. Then we can go through today's agenda. First of all, I want to give you a few technical advice. First of all, I hope you can hear us. If you have audio problems, you can change in the panel here. We have a picture from computer audio to another one and then back. It should solve most of the problems. You can type in your questions in the chat. Don't be surprised, only we can read your questions. It's not a public chat. And in the end, we will answer your questions. After the presentations, we'll have a Q&A. Another thing, today's presentation, you can download it in the tool. On the side, you have the option to click on handouts, and there you can download the PDF that we are going through today. Okay, then we start today with a brief introduction about what is Make It in Germany, and then the main topic of today, working as a nursing professional in Germany with our experts, and in the end, the Q&A session. So, what is Make It in Germany? It's the German government information portal for qualified professionals. We deliver information for international professionals and graduates, and also for companies in Germany. The project started in June 2012, and the page is available in 4 languages: German, English, Spanish, and French. By today we have 66 million users worldwide. The whole presentation is filled with links. You can see it on here. Once you have downloaded the file, you can click on them, and then you can directly, it would lead you to the page that we were talking about on that slide. So what does Make It in Germany offer? The website itself, of course, offers a lot of content about the new law, about vocational training, about living in Germany, a whole bunch of topics. We have graphics on visa procedures, we have job listings, social media, a quick check where you can check your individual options, checklists, videos, and so on. And important to mention the hotline Working and Living in Germany. It's operated by the BAMF and the Federal Employment Agency. Here you can call or use the email or chat to ask your individual questions in German and English. The topics on the website, I already mentioned it. It reaches from job search and sought after occupational fields, also nursing specialists, entry and visa regulations, the recognition of foreign qualifications, learning German, facts about living in Germany, and also, as I mentioned as well, information for German employers. As you might have heard, there's a new law coming, a new immigration law. It starts on the 18th of November with the EU Blue Card. You also find information about the changes on Make It in Germany. If you have questions about that, just type it in the chat, and we will answer them. Here you can see the page itself. So once you've downloaded the presentation, you can just click on the link and then it would forward you to the correct page. And another one, I think it's the last one before I hand over to our experts, is the job listings. You can find them on our website as well. The job listings are actually connected to the Federal Employment Agency's job listings, and here you can see vacancies where employer have proactively said, yes, I'm also looking abroad for skilled workers. They have clicked on a little box. So that's actually the advantage of the Make It in Germany job listings, that employers have proactively signalized that they are open for international applications. There's also a very practical feature. It's the job newsletter. You see the screenshot on the right side. So once you have clicked on a branch, you see the red frame here. And for example, as today's topic, the branch of occupations in healthcare. And then you find the option of registering for a job newsletter. That means you get an email every time there's a new job in your branch online. Okay, that was a little sprint. And now I'm handing over to Ms. Özjurt and Herr Posselt for the topic of working as a nursing professional in Germany.
Ja, herzlich willkommen. Welcome to the Make It in Germany webinar, Nursing Professionals Working in Germany. As I already said, my name is Pavel Posselt. My colleague and me, Hatice Özjurt, are going to give you a broad overview on the following topics. Next slide, please. We're going to give you information on the international services of the ZAV, as professional recognition, vocational training in the health sector, and the new Skilled Immigration Act from 2023, called in Germany the Fachkräfteeinwanderungskonzept. And we're also giving some hints on the possibilities on financial support. Down below, you see our email address. You always can write or register to us. And if you have any questions after the webinar, you can always write to the email address below. Next slide, please. So this is an overview of the operative units of the international services of the ZAV. Firstly, there's the customer center. That's where Hatice and me work. We provide individual advisement and information to our customer. We counsel and place skilled workers on the labor market. We also give help to those who are interested in vocational training. That's what we call Ausbildung in German. Then we have the Service Center for Professional Recognition, the ZSPA. They give advice and support during the whole recognition process or procedure. Then we have a little outgoing team. They give information and advice for people who are living in Germany and who want to work abroad. And at least we've got our recruiting center incoming. It's a regional team or a project team that place skilled workers and help people who are interested in vocational training. Next slide, please. What can we do for you as the customer center and the ZSBA? We can give you advice on topics such as visa and resident status, the recognition, also das Anerkennungsverfahren, social security and taxation, relocation, and family. We give advice on your personal chances on the German labor market, and we help you with the applications, with the CV, with a letter of motivation. We can give you help, especially also in the medical sector, because there are a few differences. You can always contact us at the hotline or also at the email address shown below. Next slide, please. The next slide, please.
Yeah.
It's there. It's
yeah,
there,
perfect.
Pablo.
Perfect.
Sorry. So you have successfully completed your vocational training as a nurse abroad and would now like to start a career in Germany. Even if you have not yet completed vocational training, you have come to the right place. We will be happy to help you start in Germany. The main reason for the high demand is the constantly number of older people as a result of improving medical care. Yeah, so that's why hospitals, nursing homes, and other care facilities are highly interested in new staff and personnel. Yeah? So we welcome international professionals coming to Germany because there is a high demand. Working as a nursing professional, what does it involve? A nurse can work at a hospital or with further specialization in pediatric or even in geriatric care. The tasks of a nurse are mainly support and care of patients, documentation and evaluation of nursing activities, carrying out of medical instructions and assistance with medical interventions. That is the main task all over the world for nurses. So the next slide, please. There are two possible paths to work in a healthcare profession in Germany. So also the two ways to come to Germany. What's with the professional recognition for people without a completed training or degree abroad, or with the vocational education, what we call Ausbildung. It's for people without a completed qualification. Also, that are the two ways to Germany. Next slide, please. Which are the requirements for these two ways are firstly a school certificate, the German language at B2 level, a 4 weeks internship, what we call practicum in Germany, a visa, and an employee, apprenticeship employee. It's where you can start your vocational training. That are the requirements for the Ausbildung. The requirements for the visa for the vocational training, you need a 16a, paragraph 16a Aufenthaltsgesetz visa, the so-called Residence Act, usually German language certificate B1, and you need also a proof that you have at least 903 euros a month at your personal disposal. A training salary, or you will get for your vocational training, that's normal in Germany, that you get a training salary, is also a possibility. There's also a visa to come to Germany to find vocational training, so that you apply in Germany at the employer's place for that's the paragraph 17 Aufenthaltsgesetz Residence Act. Those are the two possibilities for the visa for the vocational education. Okay, this was then my part. I will give further on to Hatice. Thank you very much.
Yeah, hi. Thank you, Pavel. Yes, so if you already have completed a vocational training or studies from abroad, then and it is able to be recognized, so then your way is to get recognition, or you do actually need the vocational training completed in Germany. Those are the two ways that you can that you can become a nursing professional in Germany, because you do need a professional license, as it's highly regulated. The recognition is a process comparing your foreign qualifications to the German standards, and its aim is to verify that the qualification is equivalent. What do you need in order to start the recognition procedure? Well, first of all, you need a completed vocational education or study. I know in most countries you study nursing, and there is no vocational education training for it. It doesn't matter if you've studied it at a university or if you've done a vocational education, you do need to have your documents recognized here in Germany in order to work here as a professional nurse. In addition, you need the allowance to practice your profession in your country or the country where you've done your degree, and you need detailed information about your qualifications, such as the transcript of records or any other documents of further trainings you've done. In addition, you need proof of your work experience, and you need to translate, you need to have those documents all translated. But before you do translate all your documents and certificates, please consult us, because the recognition procedure here in Germany is different in each federal state, and some need more documents translated, others less. And some want it from certain sworn translators than others. And so before you spend lots of money on translations, please consult us before having your documents translated. Yes, we have the wonderful team of the ZSBA who can help you with this. Thank you. So in addition, you do, for the recognition, for the full recognition, you do need a medical certificate of suitability, which shows that you are able to do the job, in the medical sense. You need a criminal records disclosure, a certificate of good conduct. That's also normal in other jobs in Germany, that the employer would ask you to hand one in. But for the recognition, you need it beforehand, already from your home country. And in addition, you need, or it would be good if you have a proof of location decision by the ZSBA, Service Center for Professional Recognition, called Standortvermerk as well. If you don't have it, most of the federal states will ask you to already have an employment contract if you apply for a recognition. And that's it's not always so easy to find an employer first and then get through the recognition procedure. It is possible, but it's not so easy. And our colleagues at the Service Center for Professional Recognition, they do it for free. You will get that document for free, and you will get wonderful advice from them, and they can help with many matters regarding recognition. And general recognition, the recognition procedure can be initiated without proof on German proficiency, but we always recommend to have a certified minimum level of B1, because you will need it later on in the process. And if you actually, for the full recognition, no matter of where you're from, unless you grew up in Germany and you have proof that you went to school here, you need to show proof of a B2 certificate. But it can be at the end of the process, just before you get the license. As I mentioned before, we have a team, the Service Center for Professional Recognition, the ZSBA. They counsel skilled workers from abroad and support them with the recognition procedure. They're very helpful in many regards, and they can also guide you through the process of applying for recognition. And if you're not sure yet in which federal state you'd like to work, they can also guide you on that and advise you. So I always recommend to use their services. Thank you. Here is a broad overview of the recognition procedure. It's a bit small, but you can download the presentation later on and have a better look at it. In general, it's like this: if you have a degree from an EU or EEA country, the professional qualification was acquired after the country joined the EU, you get automatic recognition, but you still need proof of the language skills to get the license to practice. And if you don't have if you acquired it before the country joined the EU, or you just come from another country, then you need recognition. You need to go through the procedure, and equivalence assessment will be done. So you choose a federal state where you want to go to and apply for recognition, and after a while you get the assessment notice. This could be a notice of approval, so that the recognition authority says, okay, this looks all good to us, it's perfect, it's the same kind of training that we do here in Germany, and the person with B2 can just start to practice, and then you get the certificate to use the professional title, or that's in most cases actually that we see, you get a notice of deficit, and then it's written in the notice, it's written how the deficits can be compensated. In some cases, it's that they just say with some proof of professional experience, it will be compensated, and then you get the professional title, or they say deficit cannot be compensated automatically, and then you have the choice of doing a knowledge or an aptitude test. So you can already get an employer, come to Germany and start working, and after a while you have a certain time, you work as an assistant during that time, and then you have the opportunity to do a knowledge test, like it's a big exam, and then after that you can have the title. Or it's always written in the deficit notice, you do like a refreshing training. It's mainly, for example, if they say you lack, I don't know, 100 hours in cardio or in intensive care, then your employer will give you the opportunity to do those hours at the hospital in that department while you're working. And then in addition, you also need to visit some courses for the theoretical part. And once you've got all these hours written down in your deficit note, then you have B2, then you're also done, and you have the professional title. In very few cases, you will get a notice of rejection, but mainly if you are already in touch with our colleagues at the Service Center for Professional Recognition, they usually can give you a good insight if the qualification can be recognized or not. In some cases, abroad, the nursing profession requires only a 1 year sorry, training. I'm a bit ill, so I have to drink some tea. Sorry. So in some cases, you only need a broad 1 year training, and then that can't be recognized here in Germany. But then they will show you other ways, for example, to complete a professional training, like an vocational education and training here in Germany to become a professional nurse. Yes, those are the options so far. We can always advise you on this. This is only a broad overview. Just to mention, individual advice we can give if you contact us via email. Yes, we also advise on visa and employment, and for your profession, a very common visa is the visa for the recognition procedure, the 16D visa. It can be usually applied for after receiving the outcome of the equivalence assessment. So you do need a deficit note. So first you apply for recognition, and then you get your deficit note. And then once you do have the equivalence, went through the equivalence assessment, then you can, with the deficit note, you can apply for a recognition visa. There's a document checklist on every German embassy's website, at least there should be, where you can see what you need in order to apply for this visa. Without an employer, you need a blocked account, where you need to show proof that for the month that you're staying in Germany, while you want to get all these things done, that you get the full recognition, you need to show proof that you have sufficient funds to live. For your profession, though, there's always a possibility to find an employer. So if you do need an employer, please contact us and we will try to help you find an employer, and so that you don't need a blocked account, so that you will be able to work at the employer. Normally with the recognition visa, you only have the permission to work currently 10 hours a week in every non-regulated profession. But if you do have an employer and come with this visa, you can work more, you can get rid of all the deficits you might have, and you will make enough money that you need to live here in Germany. Yes. You please, next slide. Yeah, thank you. Yeah, as mentioned before, there is a new Skilled Immigration Act 2023, Fachkräfteeinwanderungsgesetz. There will be also many changes, hopefully for the better, for nursing professionals coming to Germany. It's supposed to be a migration possibility for skilled nursing profession. It's supposed to be that there will be a migration possibility, sorry, for skilled nursing professionals with an EU blue card. So far, it was not really based on the salary. It was never really possible for, or hardly ever possible for, nursing professionals to get an EU blue card. But now the minimum salary went down, and hopefully it's a better option now to come to Germany with an EU blue card. There will be also, so this is the blue card is already coming into force now, I think in November. And there will be also a labor market access for nursing assistants from abroad, which is new. From within the EU, it was possible to work as a nursing assistant before, but from third countries it wasn't possible. So there might be the option to come here to Germany to work as a nursing assistant without having all your like degree completed or accepted as it is. And then hopefully then you can develop further here in Germany, so you can also become a professional nurse, but there will be a bigger market access for that next year. We are not sure completely yet when those changes will come into force. You can always find the newest update on the Make It in Germany website. That's written down there. And we actually hope that it will be much more easy for you to come here. There will be also changes within the visa for recognition that I've mentioned before. So far, it's only that you can stay for a maximum period of 2 years in Germany with the recognition visa, and in those 2 years, you do need to finish your recognition procedure. But in the future, it will be up to 3 years, and instead of working 20 hours a week and 10 hours a week, you will from starting also hopefully spring next year, you will be able to work 20 hours a week. But as mentioned before, if you do have an employer, then you can also work more. And the entry and employment under a recognition partnership will be possible. So far, as I mentioned before, you do first need to go through the recognition procedure and get a deficit note in order to apply for a visa. Now, then, hopefully next year, it will be possible to find an employer first and then start the entire process from Germany and already work at the same time as an assistant. And in addition, there are plans for an extended family reunion, so that you can't only take your spouse or your underage children with you, but perhaps or even your parents or your parents-in-law. But so how it will look like in full, and also if you can already do it while you do the recognition procedure is not entirely clear yet. We hope to get more information on this soon, and yeah, whenever there will be an update, you will see it on the Make It in Germany website. Yeah. All this, of course, the recognition procedure and learning German, which you need in order to work in Germany as a nurse, is quite, it's not cheap, unfortunately. For EU citizens or for people from Norway and Iceland, there is a EU funding program called Targeted Mobility Schemes, your EURES job. It is a mobility support project of the EU. The target groups are mobile applicants within the EU, Norway and Iceland. So also for people who just have a residence title in the EU, but perhaps not EU citizenship, it's possible to apply. In Germany, it's implemented by the ZAV, by us. For example, if you do want to, if you're from Spain and you want to come to Germany and work here, then that might be an option for you. It supports citizens to take up an employment or vocational training in one of the participating states. So you don't, it could also be if you want to go to Sweden, for example, then you could also apply for the program if you are in a participating country. And it is exclusively in the context of placement, and only individual funding is possible. Yes, please, next slide. Thank you. What funds are there? Well, there are funds for preparatory language course in the country of origin. And some rare cases, you could also do the language course in the country where you want to go to. For example, if it's like a special language course that you need to obtain your recognition, then you could also do it in Germany, for example. But in most cases, you would do it in the country of origin. There is a travel allowance for job interviews. So if you are, for example, from Greece and you have a job interview in Germany, all the traveling costs a lot of money, and that's why there is the possibility to apply for a fund there. And there's also a very cool relocation allowance, which will help you financially to move from one country to another for the job. For this, you definitely need a contract, and you need to apply beforehand, but it's a very nice allowance. So it's very helpful to have that. And there's also a recognition fund. It's a lump sum to support your recognition of academic or professional qualifications. Next slide. Yes. So far, we don't have real good measures to support non-EU citizens, but if you do, like if you come, for example, with the recognition visa to Germany and you're registered here, then there might be some funds, financial assistance provided by the local employment agency, but you do need a residential address in Germany. You do need to be registered, and then you can get to the local employment agency, and they will. There's no, you're not entitled to have this support, but if they have opportunities to fund you a language course, for example, they will see what they can do, or if it comes to translation of recognition documents, they will be happy to help. Other possible financial support could be provided by the Federal Office for Migration and Refugees, the BAMF, after the qualification for support is assessed, but also there you need to be in Germany, you need to be registered. Yes, so all of what we talked about is very, it sounds like a lot, especially the recognition procedure and the visa procedure. It can take some time, and learning German, it's very hard, I understand. If you do want to see how other people did it and how they experienced the process, the website recognition, Anerkennung in Deutschland, so recognition in Germany, they have very, very nice success stories where you can click through and perhaps relate to how other people experience the process, and also how they feel now that they are in Germany. So please have a look at it if you are considering coming to Germany. Well, yeah, I hope we answered the main broad questions that you might have had. Please get in touch with us. We would love to support you and advise you through the process. As Pavel mentioned before, we can help you with your application in German, and we can help you with your we can help you find a job, and we can also help you to help yourself find a job, so show you websites where you can look. And yes, please email us and get in touch. And now we are open for the questions from the chat.
Perfect. Thank you so much. We have a lot of questions. Just a little feedback. My screen share is, I stopped my screen share now, right? Or can you still see my screen? No. Perfect. Okay. I'm using two desktops. That's why I need this little feedback. We have a lot of questions, and I will get into it straight away so we don't lose any time. By the way, a lot of people asked about the link to the job listings of Make It in Germany. I will try to do this parallelly and send you the links in the chat. If we have a little time left, we can also go to the website together. But first of all, let's go to the questions. We had a few questions about language skills. So there was a question, do I need language skills or German language skills to work in Germany? Generally, do I need German skills to work as a nurse in Germany, and also the topic of vocational training. I clustered the questions a little bit, so maybe yeah, you can tell us more about the 3 cases in combination with the language skills that are needed.
Yes, Pavel, may I answer? Okay. Yes, so in general, if you are not a nurse, if you don't want to work in a regulated profession, it's always very helpful to speak German. But it's in non-regulated profession, it's not necessarily needed. There are more and more jobs where English is also okay, but there are not that many as the demand from abroad. So it will be much easier if you do speak some German for general professions. But if you do want to work in a regulated profession, such as a nursing professional, you do need German language skills, because otherwise, how are you going to ensure for the patient's well-being, and also in the hospitals and in the nursing care homes? They're speaking German, you won't understand the others. So you do need German, and you should already be at a B1 level once you start, but while you're still in the recognition process. It's not normally, it's not needed to have B2 before you finish the recognition procedure, but B1 is a must, because otherwise you don't understand anything. And then for the vocational education and training, we usually say you should have B2, but because of the school part is very difficult. But many already start with B1. But then your B1 should be so good that you can actually have good conversations. But later on B2, you need it in order to complete your vocational training, and it's also more helpful if you have it right from the start, because the school part, I mean, it's great if you're great at your practical part, at your apprenticeship part at the hospital or the geriatric care, but it's very bad then if you don't understand anything at school and you fail all your exams. So the more German you speak, the better.
Thank you. We have a few questions about from where can I apply. So first of all, there's a question about from where can I access the financial support. And the other one is generally, can I apply for nursing jobs in Germany from everywhere or from only specific countries?
If I can, do you want to answer? Okay.
Can answer. I can apply from everywhere, and for the financial support, it's only for European citizens, for TMS. For the non-European citizens, you have to be a resident in Germany. And, if you have a resident of Munich, München, yeah, you can only apply for financial support at a local agency, the Agentur für Arbeit München, in Munich. You can apply for financial benefits, but that are the only possibilities.
Sorry, I didn't want to interrupt. I just wanted to mention there is a WHO list from the World Health Organization, on which countries listed that from where it's not possible to recruit health personnel. It's very important to know for those people who are from those countries. Cameroon, for example, is on it. Ethiopia, I think, is on it too. So in those countries, you can't be recruited from a recruiting agency. That's forbidden. But you still, if you are individually and you want to go abroad and you want to apply, you can apply for a nursing job in Germany, also from those countries. but it's not allowed to recruit from those countries, and the visa procedure due to this might be a bit more tricky, but it is possible, but there's no recruiting opportunities. So keep that in mind. Check if your country is on that list, because those countries need their own nursing professionals, and we don't want to take staff away from other countries where it's needed.
Perfect, thank you. I go further. There's a short question. For vocational training, does it have any age restrictions? If yes, which ones?
Well, you need to have a completed school degree. It should be at least 10 years, and you need to get it recognized in Germany. So in that case, normally you're not older, younger than 16. If you are underage, it might be a bit more difficult with the visa procedure. So it's better if you're 18. But I never had it I never had an applicant who was younger than 18, but it should also be possible in some way. If there's a legal guardian, I don't know. We can find out if you contact us individually. Yeah, normally applicants should be, we normally advise applicants up to 30, who are 30 years old, but because it's normally a training for younger people, the same if you go to university, normally you're younger, but still there's also applicants who are older than that. And now with the new changes in the immigration law, there's also a plan to put so far for the visa for vocational, to look for vocational training, you need to be under 25 to look for vocational training. You can be older if you found a vocational training already, but there you need to be under 25, and I think now they put it up to 35. So yeah, just if you are interested in the job, and better always do an internship to make sure that it's really what you like doing, because it's also not the easiest job, and it also includes night shifts and everything. If you're interested in it and you burn for it, then do it. Then it doesn't matter how old you are.
Okay, thank you. We have some questions about how do I find an employer, especially questions about how do I, if I want to do vocational training, how do I find an employer to do so? So maybe we can talk about this aspect a little bit.
We help you to find an employer. We have lots of contacts because we're a federal agency, and we have in every city, every town, we have a local agency, and we have a very good contacts to so-called Arbeitgeber services, but also to others. And we help you and give you support, but we also give you help to help yourself to find yourself vocational trainings. There are different websites and information that we provide for you.
Mm-hmm. Also in the job listings of Make It in Germany, there are a few Ausbildungsstellen, vacancies for vocational training. So I posted the link on the chat. So if you click on it, you find the job listings, and there you can also look for your area, and yeah, just try yourself out. Yeah, where was I? There was, yeah.
Or contact us immediately, send us an email, and we will help you immediately to find a vocational training in the region you prefer.
Perfect. Maybe I use the opportunity to repeat. You can download the slides in your user panel in the section handouts. If you have the German panel, it's called Unterlagen. So if you open this category, you can download the presentation because there were a few questions about that. That's why I'm repeating it. And there you find all the contact details of the Federal Employment Agency and the support services. There was a question that I found very interesting about the ZSBA. Let me find it. It was about how do they choose the location in Germany, because the recognition is based on the Bundesländer. So how does the ZSBA do it?
Yeah, I can't answer for them, but it's a good question. I think they will just give you a brief overview of where you, how the federal states are, and also how the procedures are. And if they will most probably ask you if you have any friends or family in one region, because it always makes more sense to go somewhere where you know someone. I mean, especially if you haven't been to Germany before, it's always easier if you know someone somewhere to help you with the start and help you find a place to live. And I think, I mean, that's how we work. We also, when someone doesn't know where they want to work, we ask them first of all that, but we have in general many information about the different cities and about the procedures. I think that's how they work. But in order to find out, contact them and then later tell me.
Perfect, thanks. There is another question. Is it better to have a contract with the employer first to obtain a visa? What is the right order? And then do you get a German visa or a Schengen visa?
Well, if you want a visa, a work visa, or the recognition visa, it's always easier to have an employer. For the work visa, you need one. It's needed definitely. For the recognition visa, you don't necessarily need an employer, but if you don't have one, then you need the blocked account. And what was it? Sorry, what was the second question?
Is it a German visa or a Schengen visa?
It's a national visa. If you come, then you get a national visa. The Schengen visa is usually only valid for 90 days. So, and it's not that easy to change from a Schengen visa into another visa. Then you would have to go home first and apply again. So those are the national visas.
Mm-hmm. Thank you. There are so many questions. We won't be able to answer every single questions. I will post you the link of the hotline Living and Working in Germany as well in the chat, so you can contact them if we don't get to the certain question, because we are at the moment 240 people. You can imagine that there are a lot of questions, but just having said that, we go on. I think we also have a few more minutes time after 3 o'clock, I hope so. So maybe we can do a few more questions. There is a question about do nurses typically match the minimum salary required for the EU Blue Card? I was thinking we might also clarify that the EU Blue Card is not necessarily the way to go for that area. So maybe you can go first and I might add a few information.
Yeah, okay, I can try. So yeah, the blue card was so far very difficult for nurses to get, because the salary was never matched, or hardly ever. But hopefully now it will be more easy to apply for a blue card. I think now the annual salary is 39,000 or something. So for nurses who already have a lot of professional experience and who do have a full recognition, it might be more possible to find a job and apply for the blue card. So if you do get a contract with that salary or higher, then it might be possible. And yeah, but so far, I think I heard of one case before when the salary was much higher. I think I heard of one case where it happened, and we were all surprised, because unfortunately that salary is often not matched. But if not, there's also the fast track visa procedure, especially while you're still in the recognition process, and that's also a good option to apply for a visa, or just the normal way, depending on how the waiting times are at the embassy where you apply.
Yes, and also to the EU Blue Card, there are a lot of changes coming in November, as we already said in this webinar. But as a nursing professional, it's not an academic profession in Germany. So at this point, you might look at the normal work visa anyways, if you want to come to Germany to work here, and not the EU Blue Card. Which is not related to, or it's not connected to a certain salary. That's probably the main point. Of course, the Federal Employment Agency checks if everything's all right with the working contract, etc. But it's not like the EU Blue Card connected to a certain salary level. Okay, there's another question about the 20 hours working per week. I think we might need to clarify a few things here. Could you please clarify the permission to work 20 hours per week? Does it mean you can only work a maximum of 20 hours per week? How will you manage with a small income, which would be a part-time work? I thought it might be to clarify.
Yeah. So this is only for people in the recognition coming with the recognition visa next year. So far, it's still 10 hours a week, and it's only for those who don't have an employer yet. So, for example, if you didn't find an employer yet, and you say, okay, I don't care, I want to do my German courses in Germany because it's much easier to learn German there, and I want to find an employer from there, and you do have the financial resources, then you need a blocked account anyhow. It doesn't matter if you have an employer for 10 or 20 hours. But in general, for nurses, it is very possible that we support you also with this, that you do find an employer who will give you a salary based on an assistant salary if you're still in the recognition procedure, and you can work at the same time, and also more than 10 or 20 hours, because it's bound to the contract. The visa will be bound to the contract. So the 10 and or 20 years, I'm sorry, it's all very confusing because it's all about to change. But the 10 or 20 hours I was talking about, it's more if you don't have an employer yet, and you do have a blocked account, but you still want to earn a little bit aside, for example, doing an internship or taking a language course. I think we use it most for doctors who are coming to Germany and who still do an internship at a hospital and do a special language course, and they use then the 10 hours to work at the doctor's office as an assistant, for example. Because for them it's more difficult to get a contract before they get at least a little bit further in the recognition process.
Mm-hmm. Thank you. There's another question. I am planning to move to Germany and attend another language course and then look for work as a nurse. Would I apply for a work search visa in this case? So maybe we go into the requirements for the search visa in this case.
Pavel, would you like to take that one?
For the job seekers visa, I can do that. Yeah, if you find a job, that's what a visa is for in Germany. That's a possibility. Yes.
Yeah, but also it is for now the job at the moment the job seeking visa is still like this, that you also need a blocked account, and you can't work with the job seeking visa. It's written you can work up to 10 hours a week, but it's more supposed to be for trial work. So you do find an employer and you say, hey, can I do a brief period where I can check out this work. For regulated professions, it's not that easy. I think it's possible, of course, if you do have the financial resources, but it's most probably it makes more sense to apply from abroad and do several interviews and then decide which one you like best. And I hope that, I mean, of course, it's difficult if you don't see the employer in person. I understand, but there's the option to just come to Germany that way.
Visa, you have only a short amount of time, and from abroad, you have enough time to apply, and depends on your personal situation and what's the best for you.
But also with the job seeker visa, that will hopefully be easier next year. I think those changes are planned for the summer, but check the Make It in Germany website. There you can find the clear information. And then there will be also more possibilities to work at the same time. That's what they are planning, that you can come with the job seeker visa and actually work and then change the visa later. So we are really looking forward for those changes, and I hope they will help you all and us too, of course.
Perfect. Thank you so much. I thought before some of you are already leaving, it makes sense maybe to show a few pages of the Make It in Germany website, because it helps you to get first orientation, because there were a few questions that I think they can be helped by going on that website and seeking all the information that you can get, so to say. So I'm trying to do that briefly. Please give me a little sign if you can see my screen. Perfect.
Yes.
So here you would be at the start page of Make It in Germany. Now it's loading, where you can find some focus topics, but I want to focus on some certain areas. We talked about the job listings. I posted you the link in the chat. You can find it in Working in Germany and then job listings. And then you can see that there are vacancies here. You can, for example, click on the sector and then click on occupations in healthcare, social sector, etc. And then you find a list here of jobs that belong in this area. And when you scroll down, you also find the option of putting in your email address and receive vacancies in that area. Another aspect I think is really important is the visa and residence section. Here you find the requirements of a lot of different visas. So we had questions about the visa for vocational training, the visa for job seekers, the work visa, EU Blue Card. You find all the different requirements in this section here, and you find it in English, German, French, and Spanish. So for example, you go on the visa for job seekers, and then you find the list of requirements and so on. And another thing I wanted to show you is the world map, because we had a lot of questions also about language courses, etc. And in our world map, and I hope it loads quickly now, you find it in services and then advisory and contact services worldwide. And then you can, for example, let me choose a country, Mexico maybe. I hope it works straight away. It shows you the country. Down here you find, under the map, you find some special information about the certain country, a project, or maybe we have a testimonial from Mexico. But most importantly, you find the institution types that you can find in the country, like the Goethe Institute. which provides language courses. You click on it and you find the contact information of the Goethe Institute in Mexico. So this, I think, is very helpful if you in the very beginning of your journey. You find also information about finding a job. As I said, the job listing, basic information about recognition, and this in combination to the contact information, etc., you have from the ZAV, should prepare you perfectly for your plan to working in Germany as a nurse. And last but not least, I also want to show you the contact option to contact the Federal Employment Agency through the hotline working and living in Germany. You find it in service, contact information, and then you can choose email, chat, hotline. For example, I click on the hotline, and then you find the number here, the opening hours, so to say. And here you can also, if we, for example, didn't manage to read out your question today, you can ask it to the experts from the hotline. Yeah, I think I hope everyone found the handout now. Yeah, and if not, you can also contact the hotline about it, or via email. They will forward us the question, and we will provide you the slides. I want to say thank you so much to be our experts today, especially Mrs. Öztürk. You were a little bit sick and fluish, and you would still here with us. That's really great. Thank you everyone for participating. Yeah, there were a lot of people. I think this topic is very interesting for everyone. As I said, around about 250 people. Please, I try to send you the link of the hotline as well in the chat, so you find it more easily. Let me see. 1 second. It's the service. You can be live here with me, providing you the information in the chat. And then I think everyone have a good day. Thank you for being with us. And yeah, I hope to see you again in our next webinar. And thank you for being with us.
Thank you. Thank you.
Thank you. Bye.
You're great.
Thank you so much.
Thank you.
Bye bye.